From our City Avenue studios, it's The 10 Show with Bill Henley and Lori Wilson.
Okay, so I don't know if you know this or not, but elderly people are not the only ones in danger of having a stroke. In fact, our next guest says more than a third of all stroke patients are actually under 65, but there are some things you can do to reduce your risk. Joining me now with some important information is Dr. Errol Vesnedaroglu, better known as Dr. Vez. Thanks so much for being here. And you're the director of the Stroke and Cerebrovascular Center of New Jersey.
That's correct.
Cerebrovascular Center.
Cerebrovascular,
wow, these are the biggest words I've said in a long time, Dr. Vez. So thank you so much for being here. And stroke is something that can have, I mean, it changes your life. It can change your life. And so if we can help people prevent in any way or be aware of the stroke signs, that's great. So starting with prevention tips, you say the basic things are controlling your blood pressure, stop smoking or don't start smoking, control your cholesterol, control your diabetes, eat healthy foods, and exercise regularly. Those seem like basics.
They are, but they're very important basics, particularly with stroke. And I think of those, the two things that we really know that are significant risk factors are cigarette smoking, as you had mentioned, and control of blood sugar in patients that have diabetes. And the things that all of us can control, which is good for our heart health as well as our brain health, is having a healthy diet and exercise and to maintain a healthy weight, which, as you know, is a growing epidemic in this country.
Oh, yeah. Okay, so those are some of the things that you can do. Let's talk about stroke warning signs. Because a stroke is really a disease of, I guess, time. Like it's something that you're fighting time with when it comes to helping people.
Very much so. And just like a heart attack, it's a brain attack. And there's a very limited window where we can reverse the symptoms and afford patients good outcomes.
Mm-hmm. So you were telling me just before we started that, tell me about that time window. If I feel one of these symptoms, for instance, a sudden numbness or a weakness of the face, arm, or leg, should I go directly to the hospital? Because I know me, and I'm probably like most women out there, if you feel it, you think if it's once, it'll pass, and maybe that was just something off with my body.
Right. Absolutely you should. And, you know, interestingly, 75% of Americans are not aware of the signs of stroke. Mm-hmm. And if you do exhibit those symptoms, numbness, tingling on the side of the one side of the body or face, difficulty with your speech, difficulty with your balance, you should get to an emergency room immediately.
Even one time?
Even one time.
All
absolutely,
right.
Immediately.
And so, and I know people as young as 30 I've interviewed who have had strokes. So we're not talking about you have to be 60 or above to have these symptoms.
Not at all.
So anytime you notice that. The other sign, another warning sign, is sudden confusion, trouble speaking or understanding.
Correct. And that's something that's more obvious, and that generally does bring patients to an emergency room because obviously if you have difficulty speaking and you can't get words out, either others around you or you're going to be aware of that, and that's something that's a bit more alarming. But they can be as subtle as blurriness of vision in one or both eyes or just a slight tingling in the face. Now obviously all those things have to be taken with a grain of common sense, and if you're lying on your face and you're getting up off a pillow, there's some numbness there, it goes away. But if these come out of the blue, then you absolutely should present to emergency room quickly.
And trouble seeing in one or both eyes, that seems like maybe that's kind of common. You think, oh, maybe I'm just...
Well, it's actually not so common. It's not, particularly in one eye. If you're having blurriness in one eye, if you're having a symptom with very similar to a shade coming down and closing over the eye, that is a very significant warning sign.
Now, trouble walking, a little dizziness, a loss of balance or coordination, that's another warning sign?
Yes. Absolutely. And again, all these things taken in context with something that's out of the normal. Someone who has, low back disease, someone who has a difficulty getting up, elderly patients, but in an otherwise healthy person who doesn't have difficulty with their balance or gait, and that's something new, and you're thinking that, hey, this is something that I don't normally have, absolutely.
And you also say the last warning sign is sudden, severe headache with no known cause.
Yes. the worst, often explained as the worst headache of your life, and that's usually a symptom of a ruptured aneurysm or a stroke caused from a ruptured vessel, which is an absolute emergency.
And where do you feel it? Do you feel it in the back? Do you feel it?
You can really feel it anywhere, and that's one of the misconceptions, that it's localized. And if you have a ruptured aneurysm and it's on the right, you may not necessarily have pain on the right side of your head because the brain is in a contained cavity. So as soon as there's increased pressure, you're normally going to feel that globally.
And it's almost like you can't stress enough. Go to the hospital. Go to the hospital. Don't lay down. I've heard people, I laid down, I woke up, and it was so much worse because now they're in severe.
Right, just as chest pain. If you have chest pain, you're not going to ignore that. You need to go to a hospital. You're going to assume it's a heart attack. If you have any of those symptoms, you absolutely have to assume it's a stroke and have physicians in emergency room rule that out.
Okay, Dr. Vez, thanks so much. We're back with more time right after this.